Welcome back to Reel's Dissect the Question series. The best use of this video is to try to answer the question by pausing the video, writing down your answer, and a little brief description of the reason for your answer. Then restart the video and compare your answer to ours. A 2-year-old girl is brought to a pediatrician by the girl's mother because of recurrent abdominal pain and watery, occasionally bloody stools. The mother has Crohn's disease and she's worried that the girl has it too. An endoscopy is ordered and biopsy specimens of the esophagus, stomach, and duodenum are taken. The biopsy reveals a large abnormal villi and a deficiency of microvilli. Which of the following gastrointestinal functions is most likely to be adversely affected by abnormal development of intestinal microvilli? Well, the microvilli we know. Let's start with what we know. Here's the esophagus, here's a stomach, and down here is a duodenum. And in the duodenum and the rest of the small intestines, we have these projections from the cells called microvilli or microvilli that do what? They increase the surface area for absorption. And there are many, many enzymes that are placed there. They're actually synthesized. We call this a brush border. And in this brush border, in the duodenum, we know we have G cells for gastrin, S cells for secretin, I cells for cholecystokinin, many hormones, M cells for motilin, cells that also make another hormone known as enterogastrin, gastrone, not enterogastrin. Enterogastrone, which controls the enterogastric reflex to slow down stomach motility, to improve the time, increase the time for absorption. And so, that's what we find down here in these microvilli. So, some of these structures, gastrin, secretin, cholecystokinin, motilin, are involved in motility. Some of them are involved in digestion. And the microvilli themselves increase the surface area for absorption. So it looks like this is a no-brainer. But we can't stop there because sometimes there are 2 correct answers, and you know we're always expected to select the best one. So peristalsis and motility could be related to the hormones that are made there, but this is asking specifically about the microvilli, abnormal development of the microvilli themselves, which we said is involved in absorption. So looks like digestion and absorption is still the best answer. We can rule out peristalsis and motility from that. Receptive relaxation, we know, has to do with the smooth muscle. Microvilli are not involved in receptive relaxation in the stomach. Secretion of hydrogen chloride or hydrochloric acid, that's in the stomach. No microvilli there. And secretion of intrinsic factor also in the parietal cells from the stomach. No microvilli there. So it seems like we have a clear answer of digestion and absorption.